Good morning, everyone. My name is Simran Chaudhary, and I welcome you all on behalf of Voice of Healthcare to a podcast series Nurturing Bonds Experts' Insights on Breastfeeding. This podcast series aims to educate and support breastfeeding mothers and their families. This year's theme is Closing the Gap Breastfeeding Support for All, which resonates deeply with our mission to provide comprehensive support and awareness for breastfeeding mothers in all their diversity. To celebrate this day, today we have with us as our guest Dr. Mugdha Joshi. She is a lactation consultant and pediatric nutritionist at Holy Family Hospital, Bandra, Mumbai. Dr. Mugdha Joshi has been working in the field of lactations since 2013. She is an international board certified lactation consultant since 2015, and she is also passionate about supporting new families and helping them achieve their breastfeeding goals. Welcome to our show, Dr. Mugdha.
Thank you. Thank you so much for having me here and celebrating the breastfeeding week with us.
Thanks a lot for taking out time for this special initiative we have. And without wasting any time, I would like to jump onto my first question with you. So, what are some of the most important benefits of breastfeeding for both mothers and child that you emphasize to new families?
So, breast milk is a perfect gift for the baby. It's not just food, but breastfeeding is nature's way of nurturing the baby. Bonding between the mother and the baby is established by that. So, we categorize benefits of breastfeeding into four: to the baby, to the mother, to the family, and the society as a whole. So, one of the most important benefits of breastfeeding to the baby is antibodies, like immunities. Breastfed babies fall less sick compared to a formula fed baby. The reason being, suppose a mother is exposed to somebody coming to meet her by a virus or a bacteria is exposed, everybody's body produces fighters called antibodies. But if the baby and the mother, once mother is breastfeeding and maybe and the mother in the same room, baby is also exposed to those viruses or bacteria. So baby will get the fighters that through mother's breast milk. So that is one of the biggest advantage, because breast milk is a live substance. Formula 0 to 6 months for all the babies is the same. Breast milk keeps changing. Every morning milk is different than night milk. 1 month old milk is different than 2 month old. So it is like a designer food for the baby. We call it is customized for the baby. Breastfed babies have lesser allergies. Breastfed babies also get some particular proteins and fats that are required for the brain development. Even the oral or health or the dental health, especially the jaw development, is different for a breastfed baby compared to a formula fed baby, because the technique of latching on the bottle and the breast is different. Even the cancers like lymphoma and all are seen less in babies who are breastfed. Babies who are breastfed, they don't have benefits only during the breastfeed time. They also have benefits in long term, like those babies have less chances of obesity, heart diseases, and even asthma. So these are the benefits, and we all know about that breast milk is best for the baby, but it is also very important for the mother. And one of the important benefit is that mothers who breastfeed longer have lesser chances of hormone related cancers around the perimenopausal age, that is breast cancer, thyroid cancer, cervical cancer. So that is one reason I insist, don't think as 6 months of exclusive breastfeeding. If you can do beyond 6 months with introduction of complementary feeds, that would be beneficial for the baby as well as the mother. Of course, the bonding, overall stress, when the mother is breastfeeding, she feels good that, my baby is calm with me. You don't calculate how much milk is going to the baby. She sees baby is calm after feeding from me. It is relaxing for the mother. So chances of postpartum depression and all are seen less if feeding journey is, comfortable for both mother and the baby. Postpartum hemorrhage is seen less because there is constriction of vessels, means there's a lot of blood loss after delivery. So there, in mothers who start early, we'll see less blood loss post delivery. And of course, going out with a breastfed baby, like you and your baby are together, you can feed anywhere on this planet. You don't have to carry your bottle, your formula, that sterilizer. Some people nowadays have formula dispenser. You don't have to worry about anything. So these are to the mother and the baby, but there are benefits to the family as well. Cost savings. You will buy formula. I know people spending 5,000 rupees for a box of formula just because it's made from organic milk, or it has less sugar. But ultimately, human milk is species specific, means mammalian milk is species specific. Formula is made from cow's milk, so you spending so much amount on that. Then the bottles, the warmers, changing nipples, healthcare, cost is more because babies may need to visit the pediatrician for sick visits more. And for me, the one that motivates to feed is the benefits to the society. Breastfeeding is absolutely green. You don't need to create trash to feed your baby. Otherwise, we end up, what we'll do with all the bottles and how the formula is made and all, it goes in our landfill.
Yeah.
So that is one of the reasons that help me, guide mothers uh, breastfeed and have a successful feeding journey.
And you explained it so beautifully and well with all the aspects of how important is breastfeed for mother and for the child as well. As you said, it is a customized food, and if you're getting the food which your body requires, nothing is waste for you. You
Yeah.
don't have to go and buy stuff and then, okay, make it according to like we do nowadays. So I think babies are lucky that they have their customized food and that it prevents them from all those types of
Diseases.
allergies, diseases, and protects them in future as well. So moving on, what advice do you offer to expecting mothers to help them prepare breastfeeding before their baby is born? How can they, mentally, emotionally, and with all the resources they would require, they can prepare themselves?
So, first of all, I would tell them, though breastfeeding is considered as natural, generations have breastfed before. uh, I have not seen many people preparing themselves for feeding. Like when I first meet the mother, I ask them, "What are your feeding goals?" And they ask me, "What do you mean by that?" Like, I have to feed. So I'm like, did you think about it or anything? Or bottle feeding is so normalized today. Like we have not seen less breastfeeding mothers and more bottle fed babies, right? So it's like, why to learn about feeding? But if you are prepared before, because once the baby comes, we don't have time. The sleepless
Yeah.
nights are there. You need to catch up on rest, and preparing with your partner or your family member who will be with you post the delivery, so that they can be there on the same page. Otherwise, we see struggles between, mother wants to feed and mother is educated herself that, how what is normal breastfeeding, but people around keep telling her, you don't have enough, you need to supplement your baby is waking up more often. So preparing yourself, understanding what a normal feeding is, because once the baby comes and we are sleepless, we cannot think. That's why we need to have somebody, be a part of support groups. To nowadays there are online support groups as well, where they support a lot of breastfeeding mothers, and we learn from other breastfeeding mothers journey, and we don't feel alone in our journey. Like we are not the because if at the middle of the night your baby is crying from 2 a.m. to 6 a.m., online support groups are like, you post at 6 a.m. also someone or the other is, feeding the baby, and they relax you. If they are like having a 2 month old baby and yours is, 1 month old, they will tell you, I also had that during that time, so don't worry, it is normal. So it makes your journey a bit easier. Also, talking to your gynac that, I am keen on exclusive breastfeeding. I would like, as soon as the baby is delivered, give the baby to me to do some skin to skin. I would like to latch first without asking me, don't give formula to my baby.
Yeah.
Planning with your husband's paternity leave, so that, because though we feel it's natural, your mom is there, when you are in that situation, you need the people who are non judgmental about you. Like, you giving formula, then somebody in the family may say, why you're giving formula? You don't want that guilt trip, and you need to have somebody who can guide you or support you, be there for you. So planning that is extremely important than just planning about the products related to feeding your baby. So you're planning your emotional support, and learning from, maybe reading a book related to breastfeeding will also be very helpful, which will make means help you understand what is normal, because that itself is, there are so many myths around breastfeeding.
I think we have forgotten what is normal and have adapted to new trends
Yeah.
and things which are going around in the market, and we have made those things normal. But that's why these sessions with health experts like you is important, so that we can normalize what earlier it was normal, and now, like how you and I and previous generation were, treated up, brought up, and I think that is required more in now current timings. Also, you just talked about the 6 months of breastfeeding, which right, you mentioned about that. So how important it is for mothers to exclusively breastfeed for the first 6 months, and what strategies can help them achieve this goal? Matlab, without any interruptions, without any, maybe like you tell ki milk is not enough and stuff like that. So how can they prepare, and what strategies they can achieve?
So, yes, WHO, UNICEF, Indian Academy of Pediatrics, American Academy of Pediatrics, all of them recommend exclusive breastfeeding for 6 months, not even water to be given to the baby, not introducing solids at 2 months, 3 months. Maybe when we were younger, that was done. There were done, things done a bit differently. So, a new mother today may hear, हमने भी बच्चे पाले हैं, आप लोग तो ऐसे नहीं बड़े हुए, we have given you, you start early. But the researches related to feeding were less. Also, the rates of breastfeeding like has drastically dropped. There are not even 50% babies who are exclusively breastfed in our country, less than 50% overall in the world. There means different countries have different statistics, but India otherwise is considered as more traditional and all. Still our feeding rates are less. My largely practice in an urban area, I see all the mothers requiring support. Whether you do, suppose somebody gets the journey, like people think lactation consultant will help with the latch, but you are going to feed for a year. They come up with queries. If they get an advice from somebody who says that oh, you are not getting enough because your baby is getting up every 1 hour, and they have to introduce formula to the baby, that will affect her feeding journey. So, exclusive breastfeeding is ideal. But of course, with that, I want to mention, for some who are not able to breastfeed, it's not the end of the journey. If you can't exclusively direct breastfeed, you at least do mix feeding. Give some breastfeed, some express breastfeeding. Nowadays, due to technology, the way we are talking and spreading, even in breastfeeding, we have pumps, and a good quality pumps, which are not painful, which are not time consuming. You get more amount in lesser time. So pumps can be used. Mothers are working, they might be having their own practice. Many of my patients are gynec and pediatricians also, because we, if you are consultants, you don't have maternity leave for six months. You have to join earlier. So how to plan that, all that, so we have all these things. So if you are not able to exclusive breastfeed, you can do mixed breast and expressed. If your expressed is also falling short, then we choose other options like a formula feed. But don't choose it as, okay, feeding में issue हो रहा है तो formula ही देना है. They first explore other options. I even know somebody who has used donated milk, like so other mothers milk for the, their baby. Those babies were premature babies, so for premature babies is extremely important to get human milk. So for 6 months, and they were twins, so she couldn't express and give, so she tried her breast. But when it was falling short as their need increased, she posted on one of the groups, and then all the mothers who are donating milk to some breast milk banks, like blood bank, there are breast milk banks also. So some
Okay.
of them came forward and gave the milk to her, and she could do it for 6 months. only on human milk in spite of having twins, in spite of being premature. So there are options. Of course, if not, for some reason, if you have many, because this might be listened by people who have already crossed that 6 months, and I don't want you all to feel guilty. There is also something called as relactation. Your milk, it's not that if 2 months you're not able to breastfeed, it will not increase. It is demand and supply. You can start stimulating more, but you need to feel good about it. If you are stressed and anxious and feeling bad about it, your supply drops. You won't get much in the means I remember one mother who has delivered through surrogacy, and I had never helped somebody who has delivered through surrogacy, and she could get milk and breastfeed her baby. So if she could feed anybody who has delivered, they can work on it. So it's never exclusive or not. There are always means. So every drop counts. So as much as possible, you continue feeding without feeling bad, because if you feel bad and you feel, oh, this 10 ml se kya hoga, then your flow will further drop, because it doesn't motivate us to see the 10 ml, and you don't put in much effort. But every single drop counts, because it has a lot of antibodies, lot of protective things for your baby, for the baby's growth. And baby coming closer makes a whole lot of difference. So don't give up on the journey very early.
And I think your positive, a mother's positive attitude and thought makes it more easier rather than, that thoughts, okay, it is not enough and stuff like that. So you have to be positive, and in with that case, your families, friends, your doctors is there to support you.
Yeah.
That plays a major role. Also, Dr. Joshi, we have a new term that is kangaroo mother care. So, can you explain the concept of kangaroo mother care and how it benefits both the mother and the baby?
Yeah, so why we call it kangaroo mother care? Because like kangaroos, their babies are always in their pouch. So, like if there's a baby, what we say a kangaroo mother care is, mother is undressed, baby is undressed. Don't get worried ki whenever we try doing this now, people around, "Hey, baby ko thandi lagegi, baby ko," but baby is going to get the body warmth of the mother. So it's not, and we keep a blanket or something on top. Baby is turned to one side, and
Hmm.
mother is caressing the baby, smelling the baby, kissing the baby's head. They sitting and just having that time together. Like I have seen mothers, when I first do, they feel so good about it, that they are holding the baby, they are seeing their baby. First day, second day, when we do this, they are really happy to do this, and we want them to be happy, because that oxytocin which will release will help with increasing the milk supply, that help with the bonding. When the baby is about to feed and we do this, baby will start searching and turning and going towards the breast. To seeing our baby's ability to do it, just a 2 day old, 1 day old baby doing it, is so, they are so happy to see their babies doing it. And
That proud
trust me,
feeling.
yeah, babies already know how to latch. We just have to be calm, patient. Babies feel secure. See, they were in a protected environment, suddenly exposed to so many microorganisms, some lot of people touching and all. Now they have come back to you. Their ears are at the chest, so they are hearing the heartbeat they were hearing for 9 months. They feel secure, they are calmer. Like when I take the baby from cradle and unswaddle, they are crying. As soon as I put them on the mother's chest, they peacefully go back to sleep. So it's extremely important for other things, but yes, for breastfeeding, because bonding, baby's affinity towards breast increases, mother holding, because of the hormones, her production increases. So for all these reasons, everybody should talk about this to their gynacs. Tell them that as soon as the baby is delivered, can you please give the baby to me for some time? At least, like some doctors follow, then they give the baby. Then at least if you are not able to do in the OT or in the labor room, what I tell is, if you and your baby are together, as soon as you come together in the room, please tell at least family member or call the nurse and tell them to please do some skin to skin. And it's not that you miss out on if you don't do on day one. If it's a cesarean delivery or lying flat, you couldn't do, it's okay, do it day two when you are sitting little. There's never too late. So
Yeah.
whenever you are able to, please do this more. This will make a huge difference in your journey, your feeding journey, and the bonding also, and baby's ability to nurse. Baby will be calmer with you. So it should be done by every doctor to, it's like the best gift you give to the babies.
And you explained this to us and to our audience very beautifully, with a very beautiful manner, and how that mother feels and what all she goes through. I could see that from your expression, but thanks a lot for that beautiful message, the way you explained us. Lastly, what message you would like to convey to mothers who are considering breastfeeding but may have concerns or uncertainties about it?
So, as I said, you need to prepare yourself before. If you are not there, as I said, it's never too late. We can breastfeed for 2 years or more. The norm is exclusive breastfeeding for 6 months and continue breastfeeding up to 2 years or beyond, along with complementary foods. So, if you have struggles initially, you can start at any point. And as I said, okay, if you get less, it's so means, you don't have to give up, and don't discuss your feeding journey with lot of people, because you will get 10,000 advices. Consult somebody who knows breastfeeding. Luckily nowadays, lot of mothers also who struggle themselves have done this lactation courses, and they are inspired to, so there are many lactation professionals today in our country compared to when I started. And you have to trust your body, you have to trust your baby. Remember one thing: babies have breastfed without any lactation consultant for generations. We are thriving and dominating this planet today because we didn't have formula 30 years back. They were breastfed. So we have to trust our body. Today that trust has gone, and the reason is, you don't have to blame yourself that why am I not able to do it. Or I've heard people saying the baby is lazy. Babies are never lazy. Babies know much more than what we do about feeding. They are hardwired, or we say it's their basic instinct. We are the ones who have our biases, how to hold, and 10 people telling us how to do it. So you don't have to blame yourself also as a mother, because I see a lot of, I get crying calls like, doctor, I'm not able to feed my baby, because it's not just food, it's an emotional thing for the mother. She feels, I'm not enough if I'm not breastfeeding my baby, or I'm doing something, biggest sin in life that I am giving my family. Like, I have heard stories where mothers have told, when my baby had first formula, the whole day I was crying. So we need to create that support system for us, yes, but please don't feel guilty about it, because it's not because of you, it is also because of the support system that we have. Like, the government, everybody has to take efforts to create that environment. Like public places, if they have to step out, we don't have places for them to free. And they ask me, can I give one? Everybody may not be comfortable nursing, everybody may not have a support system who will allow them to nurse in public. So that may take. So it is not your responsibility, that means you feel that you are failing at something. It is a community effort that needs to be done and help these mothers feed. And it is not just for them. Remember that we are doing it for ourselves also. If we don't help our babies breastfeed, there are going to be more health issues. It's going to be more trash. Like, imagine to mix two scoops and 60 ml formula. People have made a machine, so that,
Yeah.
and that costs like 25,000. People put two scoops of powder, make that. If you do this convenient things for them, and you feel make breastfeeding more difficult, who is going to, and we are not seeing feel like, the biggest thing what I feel is, our generation has not seen other mothers breastfeed. Like earlier,
Yeah.
our mother must have seen her masi breastfeed, her bua breastfeed, but we have not. So if we have not seen something happening, for us it's a new thing. We expect a new mother, अभी बच्चा हो गया आपको आना चाहिए, वैसा नहीं होगा. So you try to find your support system, you connect with doctors who will help you with feeding, and talk to your gynec. That is your first point of contact where you will express your desire to feed and create that support system for you.
You said it right, because that way we are creating a machine and we need to see more of it so that we can normalize it. We need to create more of such situation where people, understand breastfeeding is totally normal. It is the new things, new inventions which have made this, a kind of old concept, but that is where the emergencies comes. Some,
Yeah.
like some cases you explained. In that case it is helpful,
Sometimes
but
it's needed, and it's not bad.
yes,
It's bad or not. I'm saying everybody can breastfeed.
yes.
Whether they can exclusively breastfeed or not, it varies. But if you can breastfeed, at least some amount of breast milk will go to your babies. Why to
Correct.
give up completely?
Yes. And thank you so much for spreading this awareness with us, Dr. Mugdha. Thanks a lot for your such expertise, insights, and knowledge sharing with us and with our audience. It is really helpful, and thanks for taking out time and coming to our show.
Thank you so much, Simran. Thanks a lot. But I'm really glad that, because of the technology, we are able to spread the message and people can be benefited from it. Thank you so much, and happy breastfeeding to all the new mothers.
Yes. Thanks a lot. Thank you.